Assalamu alaikum students. Hope you all are fine. Today we are going to continue our lesson Shushrutha and Ancient Plastic Surgeon. Do you remember where we have stopped our last session? Yes. Shushrutha did the operation or surgery of a disfigured nose of a stranger. Right? Nose of a stranger. Okay students, look in page number 38, fourth paragraph. In this manner, Shushrutha mended a nose some 26 centuries ago, and what he did is not greatly different from what a plastic surgeon would do today. In fact, Shushrutha is today recognized as the father of plastic surgery all over the world. Okay students, his treatise means book Shushrutha Samhita has considerably medical knowledge of relevance even today. Means he has written the book named Shushrutha Samhita, and in that he had mentioned the medical knowledge that is used even today by plastic surgeons. It indicates that India was far ahead of the rest of the world in medical knowledge. Because of this particular evidence of Shushrutha operating on a disfigured nose, we can say that India was far ahead in the field of medicine. Okay students, there was no other person in the world who used to do such surgeries. So we can say India was so much advanced in the medical field in those centuries. Let's see next paragraph. Born in the 6th century BC, means when we started the lesson I mentioned ancient period, right? Shushrutha born in 6th century before Christ, means before 2600 years ago. Shushrutha was a descendant of the Vedic sage Vishwamitra. He learned surgery and medicine at the feet of Divodasa Dhanvantari in his hermitage of Varanasi. So, he learned surgery and medicine from Divodasa Dhanvantari in his hermitage at Varanasi. Hermitage means small and remote place. Okay. Later, he became an authority in not only surgery but also in other branches of medicine. He was the first physician to advocate what is today known as the caesarean operation. Means he was the first person who did caesarean section. Means, wait children, I'll show you the picture. This is the picture students. Shushrutha was the first person who did caesarean section, means taking out baby by cutting the womb of mother. And he was also an expert in removing urinary stones. Okay ma? He was also an expert in removing urinary stones, locating and treating fractures and doing eye operations for cataract. Urinary stones means removing kidney stones. Locating and treating fractures, broken bones of hands and legs. Locating the broken bones of hands and legs. And doing eye operations for cataract. It's very difficult operation removing cataract of eyes. It was very dangerous operation. People even lose eyesight when this operation was this operation was done usually. But Shushrutha used to do such operations also. His suggestion to give wine to patients about to be operated upon makes him also the father of anesthesia. What is the importance of giving wine to patients or anesthesia, students? To make patient numbed his senses and to make him fallen asleep. So Shushrutha used to give wine to patients. For that also he is called as father of anesthesia. In this treatise, in his treatise, Shushrutha listed 101 types of instruments. His Samdansa yantras are the first form of the modern surgeon's spring forceps and dissection and dressing forceps. Shushrutha, in his book, he mentioned 101 types of instruments. They are called Samdansha yantras. In fact, his system of naming surgical tools after the animals or birds they resemble in shape. For example, crocodile forceps, hawksbill forceps is adopted even today. Okay, here in this picture you can see surgical instruments used by Shushrutha. Okay, Shushrutha was also an excellent teacher. He told his pupils that one could become a good physician only if one knew both theory and practice. He advised his pupils to use carcasses and models for practice before surgery. He advised his pupils to use dead bodies or models for practice before surgery. Okay, students, this is about Shushrutha, an ancient plastic surgeon. Hope you understood the lesson. Let's stop here. We will continue in next session. Till then, thank you. Allah Hafiz. Have a nice day.